How were surgeries performed in the 20th century? The 20th century was a time of great progress in medicine. Many new surgical techniques and technologies were developed during this time that saved countless lives. Here are just a few examples of how surgeries were performed during the 20th century. In the early days of the 20th century, most surgeries were performed by hand. This meant that the surgeon had to make incisions and sew up wounds manually. This was obviously very time-consuming and also very difficult, but it was the best option available at the time. One of the first major advances in surgery came with the development of the electric cautery machine. This machine used electricity to burn and seal off blood vessels, which greatly reduced the amount of bleeding during surgery. It also helped to prevent infection by cauterizing the edges of the wound. The electric carver is still used today for many types of surgery. Another major advance came with the development of the X-ray machine. This allowed surgeons to see inside the body without having to make large incisions. This led to the development of minimally invasive surgery techniques. The first successful kidney transplant was performed in 1954. This was a major breakthrough because it meant that people who had kidney disease could now be given a new kidney and have a normal life expectancy. Today, kidney transplants are just one example of the many different types of organ transplants that can be performed. In the late 20th century, surgeons began to use robotic arms to perform surgery. This allowed them to make very precise movements while avoiding the risks associated with traditional open surgery. Robotic surgery is now used for a variety of different procedures. One of the most amazing things about modern surgery is that it is often performed without even opening up the patient's skin. Surgeons can now insert tiny cameras and instruments through small incisions and perform surgery. That way, this type of surgery is minimally invasive and has many benefits for the patient, such as shorter hospital stays and faster recovery times. As we look back on the history of surgery, we can see that there have been many incredible advances that have saved countless lives. The surgeons of the 20th century developed new techniques and technologies that made surgery safer and more effective. And today, we continue to build on their legacy. If you are interested in learning more about the history of surgery, I highly recommend checking out some of the resources. With the rapid development of medical technology, who knows what the future will hold? Maybe one day you'll be able to have surgery in your own home. Until then, though, it's safe to say that the 20th century was a time of great progress in medicine and surgery.